physical therapy school right now, about to finish my first year at Nova Southeastern in Florida. And so I just want to talk to you real quickly today. I'm going to give you the short 2-sentence idea of what physical therapy does, which those of you who are pre-PT, you already know. I'm going to talk to you about what I think is the biggest problem in physical therapy today. And it's something that, for those of you who are interested in physical therapy, you're going to want to be aware of this for later on in your career. And then lastly, real quickly, I want to advocate to you personally about your career choice. So, what's physical therapy? We want to optimize the movement system to improve the quality of life of an individual. Most of the time, it's somebody recovering from an injury, recovering from a surgery, something like that. We want to get you to the point where your muscular system, your joint system, your skeletal system are all working together so that you can have the best quality of life you can possibly have. So that's why you may walk into PT clinics or something and you see, hey, they're doing kind of silly stuff, like really you're going to teach somebody how to get out of a chair, you're going to teach them how to step over a cone or something like that. But if you can't get onto or out of a chair by yourself, what quality of life do you have? If you can't step over your step to get into the shower without help from some sort of caregiver, what quality of life do you have? It's not good. We want to improve that quality of life so that you can have the best independence and fulfill all your activities of daily living. So that's the idea. So this is the big problem with physical therapy and healthcare today. What do medical doctors, chiropractors, psychiatrists, hospitals, psychologists have in common? You can walk into their healthcare clinic of your own free will, purchase services, and then your insurance will pay for it. Now, that's not the case with physical therapy. If you want to go to physical therapy, you have to have a prescription from a medical doctor, a dentist, or a nurse practitioner. If you want to walk straight into PT, it's all going to come out of your pocket. Your insurance is not going to cover it. That's a huge problem for physical therapy. That's a huge problem for the business, because if you can walk into these other healthcare providers who have, equal knowledge, take chiropractors for example, they have the same amount of knowledge as a PT, same length of schooling, and you can walk into them and have your insurance pay for your treatment, but you can't walk into PT and have your insurance pay for your treatment. Not good. So referrals are required from healthcare providers, and we want to try to bypass that. One of the main priorities for the physical therapy profession is to get to the point where anyone can walk into the clinic, buy services for what they think they have a problem with, and have insurance pay for it. Just like you do when you think you have a cold or something, you go to the doctor, and all you have to pay is a little copay. Your insurance covers the rest, you get medication. That's what we want for you when you come into PT, and this is called direct access, where the consumer has direct access to the healthcare service that they're looking for. So what's stopping direct access in physical therapy? It's legislation, unintelligent laws made by career politicians. So PT is still relatively too young for legislators to give it any real viability. Law, medicine, these things, not in the way we know them today, but as a whole, medicine has been around for thousands of years. But physical therapy hasn't even been around for a century. It'll turn 100 years old next year. And so because of this youth of the profession, it's not given the respect that it's trying to build for itself. So even though you can walk into a chiropractor's office, have him crack your CNS, and have your insurance pay for that, you still can't walk into a PT clinic and for some treatment for some knee pain. You'll hear me say that again, because that's one of my big problems, especially with the chiropractors. We have a big war going on. So it's annoying for people who want to go straight to physical therapy to have to go to their MD, give him a $30 copay just to refer him out to physical therapy. Why not bypass that, go straight to the physical therapy office? That would be much more convenient, especially for people who know the benefits of physical therapy. Maybe they've already had some for an injury. They've seen someone else in their family go through physical therapy and have good results. They want to be able to bypass that and go straight to the physical therapist, because you don't want to go to your surgeon who you're trying to avoid giving him your business and get him to send you to PT. He wants to chop you all up. You should want to go straight into physical therapy and get those benefits that you know exist. So why do physical therapists deserve direct access? Because they have a specialized knowledge. The physical therapy coursework has expanded so much over the past years that it's no longer possible to be a physical therapist besides a PTA without having your doctorate in physical therapy. Back in 1996, that's when it first leveled up from a master's to a doctorate level. And as of 2015, you cannot find any more master's programs, any more bachelor programs for physical therapy. You have to get that doctorate if you want to be a practicing doctor of physical therapy. So this large knowledge base allows physical therapists to practice with autonomy, meaning they make decisions based on their own clinical experience, based on what they think is right. So for those of you who want to go to PT school, you'll find this out later. You take a lot of classes, you think, really, how's this related? You're going to have to take a pathology class and learn about diseases. You're going to have to take a pharmacy class to learn about how medications impact a person's ability to exercise, how it impacts their bones, their muscles, ligament strength, all of this. Things that you normally think, really, that I thought physical therapy was all about exercise. There's so much more now. It's such a giant knowledge base that physical therapists should be allowed the direct access they deserve because of that large knowledge base. PTs know enough that anyone should be able to see them for treatment if they want to. And again, if you can walk into your chiropractor's office, have him crack the bones around your spinal cord, and then your insurance will pay for that, but you can't see him for some knee pain, see a PT for knee pain, that's unacceptable. So the goal of PT is for the common good. We want people to be more active in their lives, because more activity in your lives means a longer and healthier life. You can't have more activity if your joints, your muscles, your bones are working together properly. We don't want to just heal the injury you have. We want to make it to where you can be more active and have a better health through improved quality of life. Your quality of life's not good if you can't get into or out of your bathroom by yourself. So we want people to be active. It improves your life and reduces your mortality rate. You may have heard this, that exercise is the best medication, and a physical therapist is an exercise specialist. Any type of exercise, if you accumulate 150 minutes a week of exercise, you cut your chances of dying by anything in half. 45 to 50% reduction in all-cause mortality from just a little bit of exercise every day. And you can't exercise every day if your movement system is not working. So the goal of PT is to get people healed, then get them active. So, just quickly want to show you, this is the U.S. You all know that. I want to relate to that idea of inactivity being a cause of disease. So, the nice dark states, that's where people are getting all their activity, they're doing their good exercise is 150 minutes a week. And then down here where we are, nobody's really getting any exercise. So I want you to remember that as we look at a few quick diseases, that here and here, people aren't hitting even the minimum requirement for exercise. So this is all coming from the Center of Disease Control. I have those references for you if you want.
Can you go back for a minute?
Sure.
How many of you are from those states that are in blue? 2 of you. Okay. How many of you are from those states that are white? Oh my, oh wait, I gotta take a picture, y'all. This is crazy. Okay, because the reason, put your hands down. The reason I did that is because I want you to know that this is relevant to you. Okay? Sorry.
That's good. Okay, so not getting activity, I'm going to relate this to, skipped everything, to all these diseases. Okay, so here I'm going to throw the big scary one at you first. Here's cancer. Now as you look, the darkest patches are in that southeast area. Now there are a few extras, but look, where do we have the most cancer deaths? In the places where people are the most inactive. Because when you're not active, your metabolism isn't working properly. When your metabolism isn't working properly, you're not going to break down those cells that are eventually going to become cancerous later on. So the big scary one, a lot of the cancer is in the southeast where people are inactive. Now here's obesity. I think everyone understands that with reduced activity, you're going to have more obesity. That was pretty common. Here's heart disease. This is the #1 killer in the U.S. Where are all the heart disease deaths? Concentrated in the southeast. Where people are inactive in their day-to-day lives, not hitting those minimum exercise requirements. Here's diabetes by state. Now you see it's pretty widespread because this is super common. Something like 1/3 of the U.S. has type 2 diabetes. And the darkest patches, you'll see again, southeast, where people aren't hitting that minimum activity requirement. It's a huge pattern here. And then the one I think is the most interesting, this is Alzheimer's mortality by state. Now besides Washington and California, which is where they think socialism is a good idea, we have most of the deaths coming from the southeast. Why? Where people are inactive in their day-to-day lives. What you may have not heard before is that exercise is neuroprotective, and it's the only thing that we know for sure right now that is neuroregenerative. You may have heard your parents tell you, hey, don't watch too much TV, you'll melt all your brain cells and they won't come back. We're finding out now that that's not true. We're finding out that exercise generates the growth factors in the brain that produce new brain cells and new brain cell sprouts and connections. It's the only thing we know of that actually grows more brain cells and will reduce your chances of dying from even something like Alzheimer's. So that's my inactivity theory of disease, and exercise makes it much less likely that you'll die from any type of disease. And you can't get that exercise if you can't use your movement systems properly, because your joints aren't working, because your bones aren't working, because your muscles aren't working together in unison. And that's what a PT is trying to do for you. So all that stands in the way of the direct access is just some legislation. So these are our lawmakers in Alabama. They ran for office, so we get to bother them by sending them emails and calling them all the time. And so I'm going to put this online. So this is for if anybody wants to contact them, I bother these guys. It's fun. They deserve it. And then I took this lady down because she's not running for re-election. Now that's pretty much the end of what I call the biggest problem facing physical therapy today, the lack of direct access to the consumer. Then lastly, I want to advocate just quickly to you personally. This is my last slide for everybody who's ready for this to be done. I want you to both consider and not consider a career in physical therapy. If it's been your dream your whole life to help people move, to improve their quality of life through physical therapy, definitely consider it. However, if you're not just for PT, but if you're on the MD track, you're on the chiropractor track, you want to be a dentist, I don't want you to consider any of those fields if you're motivated for some external reason. Because healthcare is too difficult for you to go into it and be motivated by, I got to impress my parents, I have to impress my friends. You may have had your parents say to you, oh, you're so smart, you should be a good doctor. Or your friends, people at church, you're so smart, you should go to medical school. As if that's the only thing that smart people do. There's so much more to science than just healthcare. And there's such a huge burnout rate in all these healthcare professions because people are going into them motivated by some external source. So there's more to science and health than just the medical field. There's people who are inventing these medications. You guys have heard of the coronavirus. It's brand new. Guess who's going to figure out how to fix that problem? It's not going to be the MD. It's going to be that weird guy with the microbiology PhD who figures out how to extract some protein from a cell to blow up the virus. It's not going to be a medical doctor. They just dispense what other people invent. And that weird guy with the PhD in microbiology, he's going to get the $1 million research grant for the next 30 years because of that discovery. There's so much more you can do with science than just medicine or pharmacy or physical therapy. So at the end of the day, what you do needs to be important to you, not to your parents, not to your friends, not to anyone else. Choose what aligns with your talents and your abilities and your skills. Otherwise, you're going to be super burnt out because nobody's really sitting around thinking, wow, that guy's such a great doctor. I know people think that, oh man, that guy's so great. People who, anything they do, this happens a lot with, if you play sports, probably happens to you. You think everyone thinks you're so cool because you play sports and you wear sports clothes. But really, it's only cool to you. So, you've got to do what's cool to you and what aligns with your skill set. Thank you very much for listening. If you have any questions, I'll take them. If not, if you think of them later,